Hi there, good evening, fellows. This week for our assignment, we're going to talk about a lower quadrant technique followed with neuromuscular rehabilitation, neuromuscular re-education. So I have Siva here, and can I have you turn face? Can I take your shirt up a little bit? Is that okay? Okay. Can you undo your hands? Okay. So we know from our previous history that Siva has scoliosis. We talked about a lumbar instability in our previous videos. So I've already scanned Siva and we've done the treatment on thoracolumbar junction manipulation for him, and we've determined it's a psoas facilitation. One thing I want to address this session is that the functional antagonist for a right facilitated psoas would be the left femoral glute max and piriformis. So I want to talk about hip mount tracking for him and work on firing that. So can I have you lay down, Siva, on your back, shoes out, please? Okay, so for a hip mount tracking, the key factors that I am looking at is I have him lying down even. I'm coming and I'm looking at the ASIS. I'm palpating, I'm seeing if one is higher than the other. So I want to rule out my ilium rotation. Is it anteriorly or a posteriorly rotated ilium? If that's a thing, I would fix that. Since we're focusing more on hip mount tracking for this assignment, I'm going to talk about his left hip here since we have a right facilitated psoas. The hip mount tracking testing is done passively. The three key factors that I am looking for hip mount tracking is that when I passively lift his leg up into flexion, I want to see at 90 degrees, is the knee falling out or is it tracking right in alignment? So I'm looking for that tracking. So needless to say, his hip definitely tracks outside. So I'm looking for that. I'm bringing his leg in and out. I want to see how's the hip external rotation and internal rotation. The second key thing would be, is the internal rotation blocked or does he have a full internal rotation? For hip external rotation strength, which is our third factor here, I'm going to bring him into a shortened range at 90 degrees flexion, and I'm going to say, okay, Siva, I'm going to give you a resistance. Don't let me pull you out. Ready? Hold, 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 and relax. I always compare this to the opposite side to see, is it any different or is it the same? Because I want to see, is there a functional difference in the strength, the hip internal rotation, and the tracking. So to address the hip mount tracking, I'm going to have him turn to his right side. Can I have you scoot back towards me? See that? Keep coming, keep coming. I have him in about 70 degrees of hip flexion here. I'm coming, palpating for the ASIS and the greater trochanter on the left side. I go right posterior to the greater trochanter and I'm feeling how's the joint move. Can I give him a little glide here? So I do a pre-minute hold. I push and I hold it. I ask him, does that hurt? Is there any pain? And if he says yes, then I'm probably not gonna do the manipulation. But Siva, does it hurt?
No.
Okay, can I go ahead and give you a quick slap in your glute here? So I come back, I give a quick push, hold, and relax, come back, and then my direction of forces hitting my thumb, going back up. And then I'm palpating to see how's the glide. Is the hip gliding good? For neuromuscular re-education for this, I have him keep his feet both solid here. I'm coming and giving some resistance right at the knee. Siva, I'm gonna have you work into this movement, okay? So I'm giving him resistance and I'm gonna say, okay, Siva, push your top knee into my hand, push, hold, 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 and relax. Again, push, hold, 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 and relax. Again, push, hold, 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 and relax. So right after the minute, I followed up with the re-education where I'm doing an isometric hip abductor hold for him. To follow it up, I'm gonna have him, I'm gonna put a band around the knees and have him just do his clamshells. Can I have you bring both feet up, bring your knees up. Perfect. Okay, see what I want you to do is keep both feet here. The tap knee, I want you to do a quick out, hold, and slow in. 3, 2, 1. Again, out, hold, 3, 2, 1, slow in. So this is also gonna be his homework. I can have him start first thing, do this in lying down, and as we progress it to standing as well. Can I have you stand up? Keep the band around here. We can also do the same thing in supine lying. So from right here, I can say, okay, keep this leg solid, just the tap knee. I want you to bring it out to the side and then slow back in. He's controlling. It's a quick out, hold, and slow back in. Perfect. Can I have you stand up, Sita? Face the mirror. So something I like to give my patients here is the same thing in standing. So I'll have him go into a small squat. Good. Maintaining that. Can I have you bring the left knee out? Good. And slow back in. He's keeping the right leg solid. I am having him engage his pelvic floor and glutes while he does that. That way he's not overarching, going into lordosis with his back. Perfect. So once we did his lying down, side lying, and standing clamshells, for several of my athletes, I will go ahead and I will have them, can I have you take this band out? Perfect. So let's position this here.